what do you see as the solution that is going to incentivize folks to practice in Maine, but to practice at all? I think that it's hard to say, you should be in medicine when there's such a bureaucracy and providers are they're burning out at incredible rates.
So I'm really glad you asked me that question. There are two things in particular that have to change. Right now, in the insurance network, we have a separation of the insurer themselves separate out denials as being away from medical decision making. Mm-hmm. And because of that, it theoretically absolves them of the liability of denying medical care. Mm-hmm. The stipulation is that because they're not medical doctors and this is an economic reason or an algorithm, it's not actually medical decision making, and therefore they're not liable for that. If at a state or a federal level, we eliminate their ability to perform those unnecessary denials without bearing the responsibility of medical decision making, it's then going to quickly rectify the unnecessary costs of care that are due to the system becoming more expensive because we are intentionally denying patients from having access to the tests they need, that then exacerbate the condition, that then results in more expensive care, damages. If we allow that system to self-correct, then we're going to see insurances actually start to then be financially a little bit more aligned with getting the patients what they need quickly to solve the problem. That's the first major system that has to happen at a federal level. The next thing that has to happen is that we have to stop putting patient health and health of our population on one side of the table and shareholders on the other side of the table. There just isn't going to be a scenario where the shareholders of United, for example, or the shareholders of any major insurance company have a agenda or a goal that is disincentivized with the policyholders of that same insurance company. We can't, as a population, as a society, we can't hold people and their healthcare needs as being less important than the profit of another entity. We can't, and currently, because the system allows for that to happen, healthcare insurance companies take advantage of a lot of healthcare providers' inner sense of altruism. We didn't do this to just make as much money as possible. We would go into hedge funds or finance or things that
would not go into medicine.
We would not go into medicine
wealthy.
If the goal was to make as much money as possible with as little effort as possible.
Well, I think, isn't direct primary care the where you can see this the most clearly? The success of the business is dependent on the success of the patient care. These are absolutely interwoven pieces here. If a patient is not happy with the care that they're getting, they're going to leave, and that business is going to fail.
Yep.
And so it is absolutely incumbent on that practice to make sure that their patients are happy with their care, that they are getting to the root of the issue, that they're getting quality care, because their practice won't survive if they're not. And so that separation you're talking about is really tremendously harmful to healthcare, turning it into crisis care.
Yep.